It is estimated that about two-thirds of new HIV infections in West Africa and Central Africa in 2017 occurred in Nigeria, with 150,000 people dying from HIV/AIDS-induced illnesses. The country is also experiencing poor treatment coverage, as only 33% of those living with the ailment received treatment. The statistic is even worse among the youths.
You get such scary details once you go to these facilities. We get facilities where they record as much as 30% of the adolescents failing on their treatment regimens. And Nigeria only has provision for 2 treatment regimens on our treatment program. Any other treatment regimen will have to be outsourced by that person privately. So you have quite a number of young people having failed both treatment regimens, simply because we have a treatment program that does not respond to the peculiarity and needs of young people living with HIV.
Also, psychosocial support in form of special intervention funds for patients is also near absent in most communities, despite the adoption of a test and treat policy in 2015 aimed at enabling those with the disease have access to treatment.
The first thing is to ensure that Nigeria as a country recognizes and pushes for the relevance of psychosocial interventions in their programs and their plans, so that whenever we are having those conversations with our partners, we can tell them that psychosocial support is a non-negotiable part of our national response.
Certain healthcare facilities, it's really a key barrier where adolescents do not have access to sexual and reproductive health rights, and then adolescents do not have access to HIV treatment, because you get a recurring training that comes up annually or periodically for this healthcare, because there are healthcare workers who are willing to work, but do they understand adolescents? Did they really know how to handle adolescents?
These youths living with HIV in Nigeria say for the disease to be reduced, especially among the youths and children, the country must be committed to ensuring that treatment programs that take adolescents into consideration must be put in place, in addition to the removal of user fee. Aqua Ona, AIT News, Abuja.